Okay, this is Dr. Hall, and we're going to finish Lecture 17 on birth with our final section talking about some potential complications, just focusing on 3. So, complications. Pregnancy and birth can be dangerous. So even today, with all of our medical facilities and medications and blood transfusions and ability to do C-section, we still have a mortality rate or rate of death of about 1 in 5,000 pregnant women will die during pregnancy or childbirth. Now, this is much improved compared to what it was 100 or certainly 200 years ago, but it's actually still pretty high. Giving birth is still a dangerous thing. And in fact, it's more dangerous here in the United States than in any other developed nation. Our maternal mortality rate is more than double that of countries like Canada or the United Kingdom, France, Norway, Italy. Our mortality rate is even more problematic when you look at the racial breakdown. So in our country, Black women have a disproportionately higher rate of mortality. So their rate is 1 in 2,300 die as a result of pregnancy and childbirth, where for white women, it's 1 in almost 8,000, right? So that's more than twice as high, almost 3 times as high. And so you might wonder, well, why is this? And the answer is, of course, systemic racism. But to unpack that a little bit, oftentimes Black women have less access to health care, so they are more likely to be impoverished or to not have a job that will give them health insurance. They also have, as a result of being part of a minority group, they tend to have disproportionately higher medical problems at baseline. So African Americans have higher rates of high blood pressure and heart disease just at baseline. But very troublingly, they're also less likely to be believed when they say that something feels wrong. People tend to dismiss Black women's concerns much more readily than they do of white women or women of any other race. So we're going to talk about our first potential complication, and then I'll give you a case example that kind of highlights this terrible disparity that we have. So the first potential complication that we're going to have is blood clots. So DVT stands for deep vein thrombosis. And what that is normally blood flows through your veins, no problem, right? Here goes your blood flowing up through your veins back to your heart. But every now and then, sometimes some of that blood can form a clot. Interestingly, estrogen increases your risk of blood clots, and estrogen levels are very high in pregnancy. So your risk of getting a blood clot in pregnancy is anywhere from 1 in 300 to 1 in 2,000. So pretty high risk of getting a blood clot, relatively speaking. If a piece of that blood clot breaks off, it is called an embolus. And if this happens, the first place that embolus is likely to get stuck is actually in the blood vessels of the heart. So we can see here as it's kind of moving up through the veins, everything is getting bigger and bigger inside the heart. That's all big, and then it goes out, and then when it gets into these blood vessels, these pulmonary arteries in the lung, they start to branch and get smaller and smaller. And so what can happen then is that embolus gets stuck. It gets lodged in a pulmonary artery and cuts off blood supply, right? It completely blocks off that artery, cuts off blood supply to that region of the lung. That is called a pulmonary embolus. This is dangerous. This is potentially life-threatening. In fact, it's one of the few things in terms of medical problems that kills people in your age group. It's not common, but it can definitely happen, and it's a known complication of pregnancy. So the case I'm going to share with you is that of Serena Williams. So this is from a story in Vogue magazine. And so Serena had a relatively easy pregnancy, but then things didn't go well. So first of all, her daughter Olympia had to be born by an emergency C-section because the baby's heart rate got really, really low during contraction. So that would be that fetal distress that we talked about, a medical emergency, something going wrong with the fetus. So you need to do a C-section to get them delivered rapidly. Right? Then everything went okay, but the next day, all of a sudden, Serena felt short of breath. So she has a history of blood clots. In fact, she has a history of so many blood clots that she's usually on a daily blood thinner medicine. But of course, they had to stop her blood thinner because she had a C-section, right? And if you're gonna have surgery, we don't want you to be on a blood thinner, right? So she correctly immediately assumed she was having another pulmonary embolism, right? A blood clot in her lungs. She's had this before, right? So she went out of the hospital room and told the nurse, you know, gosh, I think I'm having a pulmonary embolus. I need a CT scan and some IV blood thinner. And she was correct. But instead of taking her at her word or even really thinking rationally about it, the nurse just poo-pooed this, right? And said, oh, I think your pain medicine is just making you confused. So Serena Williams then had to kind of advocate for herself with the nurse and be like, no, really, right? And that, you know, Serena Williams is an incredibly accomplished young woman and very strong and has a lot of clout, right? And so she had the self-confidence to persist and not just say, oh, okay, the nurse said it must just be my medicine. I'm not going to worry about it, right? So she persisted. And then finally they ordered a Doppler of her legs, which is not actually what she needed. And so she kept telling them, right, I need a CT scan. And so finally they did it. And she had several blood clots in her lungs, right? So, you know, even someone who is incredibly accomplished, right, and we still tend to dismiss their concerns or think that they don't know what they're talking about. So this is a problem. We need to do a lot better by people. This is some additional information about the disproportionate mortality that we find in Black women around pregnancy and childbirth in this country. If you're interested in this information, these are a few pull quotes from that article as well as the link to it. But, you know, there's some examples down here, right? So there's a mother in Nebraska with a history of hypertension, which is high blood pressure, who couldn't get her doctors to believe she was having a heart attack until she had another one, right? Another young mother in Florida who was having breathing problems, and the doctors blamed it on the fact that she was overweight when actually her lungs were filling with fluid and she had heart failure. Or the Arizona mother whose anesthesiologist assumed she smoked marijuana because of her hairstyle. Or this Chicago area businesswoman with a high-risk pregnancy who was so frustrated with her doctor not taking her seriously that she changed doctors in her 7th month and then ended up having a fatal stroke after childbirth, right? So we need to be really mindful and careful, and we need to do much better. So blood clots, DVTs, and pulmonary embolism are one potential complication of pregnancy and childbirth. The other one is this strange syndrome called preeclampsia, which can then progress into eclampsia, which is also called toxemia. It's this very strange thing that can happen during pregnancy where blood pressure gets high, they start to get swelling in their hands and feet, and they start to lose protein in their urine. Usually that doesn't happen. The kidneys normally don't let any protein escape in your urine. This syndrome is very bizarre, and it can lead to life-threatening liver, kidney, and blood cell dysfunction. It can also cause seizures and death. So if this happens, right, there are very few treatments available. Usually the only treatment that is definitive is to deliver the baby. So this can be one of those reasons why we might do a C-section or an induction in order to get the baby out, because once you end the pregnancy, then this tends to resolve. Unfortunately, it takes several days to resolve, so the woman is still at risk in those first several days after childbirth. So I don't know if any of you are fans of the show Downton Abbey, but there's a character there that had preeclampsia, and it was heartbreaking. All right, so that's preeclampsia. So if you get pregnant someday or know someone who does, at those routine doctor checks, they will be checking blood pressure very frequently. They will also, especially towards the end, be checking urine for protein to make sure that the pregnant person isn't developing preeclampsia. The final complication we're going to talk about is hemorrhage. Hemorrhage as a word just means excessive blood loss. So you already know that when the placenta detaches, which happens in the first, 5 to 30 minutes after the baby is born, right? The placenta is going to separate off from the endometrium, and there will be this raw spot there that's going to bleed. So what the uterus normally does is contract down on itself. So you can see in this picture here, right? So that uterus was big and stretched out to the size of a watermelon, but it's going to contract down onto itself to put pressure on those bleeding areas to slow the blood loss and allow for clotting and healing to happen. So normally after childbirth, people have bleeding for about a week or so, equivalent to a heavy period. But sometimes they bleed a lot more. And so that would be a postpartum hemorrhage. And we talked about, so I just talked about the uterus contracting down on itself. So if it doesn't do that sufficiently, and that's what's shown here, then she just keeps bleeding, right? And bleeding and bleeding and bleeding. And so that's why the nurses will push on the belly and make sure the uterus is contracting down and nice and hard like a stone quite frequently after the baby is born. This is the most common cause of postpartum hemorrhage, is that the uterus doesn't contract down on itself. If the uterine massage doesn't work, there are medicines that we can use. And very rarely, in extreme cases, sometimes they'll actually have to do a hysterectomy and remove the uterus, because sometimes you just can't get control of it. Other things that increase your risk for postpartum hemorrhage are problems with the placenta. So remember, we talked about if some parts of it don't detach properly, and that you're more at risk for that happening if you've had a previous C-section and scar tissue on your uterus. So that increases your risk for postpartum hemorrhage, because if the placenta doesn't fully come off, then you can't really get good pressure on that area. And then, of course, if there's some type of blood clotting problem, like some of these can be genetic or run in families, then that can also cause postpartum hemorrhage, but that's a lot less common. So in this lecture series, we have talked about how birth in humans is more difficult than other mammals because we have a relatively large head and a relatively small pelvis because of our big brains and the fact that we walk on 2 feet. Stage 1 is labor, repetitive uterine contractions, positive feedback mechanism via the baby's head pressing on the cervix, sending messages up to the brain, which then tells the pituitary gland to make oxytocin, which causes more uterine contractions. Stage 2 is pushing or fetal expulsion, and so the woman is going to bear down, add her efforts to what the uterus is already doing, push the fetus down through the pelvis out into the vagina as it distends the vulva that is crowning, and then we have to be really sure that we get those shoulders out. And you'll remember too that the fetal skull is designed to be kind of moldable to help assist with this process. After the baby is born, we have that crucial fetal transition where it has to regulate its own body temperature and breathe for the first time. And then stage 3 is when the placenta separates and is pushed out. And then we really want to make sure that the uterus clamps down on itself to prevent bleeding. Then we talked about medical interventions such as epidural anesthesia and C-sections. We have high rates of both of these things in this country, and we just need to be really thoughtful about that because there are certainly benefits, but there are also risks involved. Then in this last section, we talked about how maternal mortality in the United States is actually much higher compared to other developed nations, most especially for women of color. And we talked about 3 preventable causes of maternal death. So thromboembolism, which is a blood clot, either a DVT or a pulmonary embolus. Hemorrhage, usually due to the uterus not clamping down, but can also be due to placental problems, such as from scarring from previous C-sections. And then preeclampsia and eclampsia, which is that weird syndrome with high blood pressure, swelling in the hands and feet, and protein in the urine. So that's it for birth. We're going to transition now into how do you not get pregnant. So our next upcoming lectures are going to be about birth control.